So, good morning to all the participants, I should say, around the world. So, happy to welcome you all as a principal and then organizing chairman for this international FDP on health research for physiotherapists. I mean, the health professionals. So, without further ado, let me start the session right away. First one is the dimensions of a health research. So, health research is a bigger domain. So, as I have told you in the beginning, I'm just focusing on the physiotherapy aspect. And the examples what I'm going to give and then the concepts I'm going to derive is going to be on the physiotherapy research. But it's going to the generic one. Generic one in the sense all the components, all the domains what I'm talking about, it's the umbrella term for the whole biomedical research as such concern. And here what you are seeing on the screen is the dimensions of the health research, like why we do research, like and the purpose or maybe the objectives or the different thing. And before getting into that, these are the dimensions of the perceptions why people getting into the research. Okay. And first one is the theoretical and maybe the applied research. Whereas in theoretical aspect, where as a researcher or maybe as a academician or maybe even a clinician, and your aim is just focusing on developing a new concept or maybe a theories. Okay. For example, and if you have been handling a cases or like particular condition for a long time, so maybe you might end up in getting an idea of new approach or maybe a new method or new protocol, a rehab protocol, or maybe new device you or maybe as a treatment as such. Okay, it can be a concept, it can be a theory. So, which means it is not in existence as of now. So, you are just proposing a theory or proposing a concept. Okay, or you are into developing a concept, and that may be one of the reason why people getting into the research. And other one is the applied one in the sense is like solving a real life problems in the sense like where the pain is not reducing, where why you don't get the full ROM, and why there is no functional improvement, why there is no cognitive improvement. It depends on your domain or maybe your specialty. So where you are getting into the process of solving the existing problems out there. That is another reason why people get into the research. Okay, one is the theoretical, other one is the applied. And next one we have the preventive and then therapeutic research. Whereas again preventive, as the name suggests, of course, being a physio, where you have the plays the greater role even at the community level or maybe at your clinical level or whatever. Okay, so we plays a major role in preventing the illness or preventing the stiffnesses or preventing the hazardous effects or maybe the complications of your surgery or maybe preventing even a metabolic syndrome to some extent. So these are the aspects again people get into the research, and also the therapeutic research which I have mentioned before. And the third one is like bench based and then bedside research, whereas the bench based is something like more not into the physiotherapy domain, but being a researcher, you just have to have an idea. Where the bench based like molecular research, where the researchers get into the animal studies or maybe at the molecular level at the lab setup. Whereas it has to be translated to the bedside research, where being a physio or maybe a medico or maybe any other health professional, where these lab level findings has to be tested or maybe translated onto the human beings. That's what we call it as the bedside research. And next option can be exploratory and confirmatory research. Whereas exploratory is something like where you have a limited knowledge of something, okay, and where the clinical scenario or maybe a literature review suggests that there is not enough evidences out there, where you have to explore into that hypothesis, okay, maybe like factors influencing the adherence to the physiotherapy, okay, adherence to the physiotherapy program, why there is a lot of attritions on the therapeutic approach, why there is a lot of attritions or dropout on the exercise program, why people are not adherents to their exercise program or exercise teachers to the patient. Okay, and there if someone want to explore, okay, that's the example I did. And if that is your question, research question, it became an exploratory type of research. And whereas when it comes to the confirmatory research type, were conducted when clear hypothesis already exist, okay, and you have the hypothesis and you have to test it on your research. Maybe like you can take example of RCT, okay, and these are the various dimensions of the research which I was talking about right now. So in summary and a quick summary, I just tell about the theoretical, where you are developing a theory, and applied research where you are trying to solve existing real world problems on your patient, and preventive and therapeutic. Okay, your aim is to prevent, or you are testing on your therapies or something like that. It becomes a preventive and therapeutic type of research. And bench based is something like translation of lab to the human, or maybe like animal study to the human studies, or maybe like lab molecular level to the kind of a clinical trials ultimately end up on the human studies. And exploratory and confirmatory ones don't have the enough information, and you have plan to explore why there is a lacunae in this particular domain. And maybe a confirmatory, you have the clear hypothesis and you are just want to reinforce, or like you want to test it again to find the clinical findings of the research. Okay. So next one is the principles of a health research. Principles in the sense there are stages involved. What are the principles before getting into the research? Of course, there are certain principles has to be followed. So what first one is your planning. The planning stage is very much critical, because before getting into the whole research process, a researcher, an individual researcher, or maybe a group of researchers. Of course, doing a research is a type of a teamwork. Okay, someone can be formulating like coming up with the hypothesis, or someone will be formulating a treatment protocol, someone formulating an assessment, and someone doing outcomes, and of course someone involved in the writing part, whatever. Okay, so altogether it has to be started from the planning. So planning in the sense, right from your research question, writing your aim and objective, what are the outcomes has to be done, how the intervention has to be carried out, and how much should be the sample size, and where you are going to get the data, and how you are going to get the data, how you are going to avoid the biases. Everything has to be planned very well beforehand when you, conducting, or before you conduct the research itself. And there is a teamwork is involved. Okay, so teamwork in the sense, as I have told you in the very beginning, teamwork as such, like people, there are multiple people involved in the research, right from your the conception of your idea, or maybe framing the hypothesis, and then conducting the study, evaluating the study, doing a statistical part, and interpreting the result, and deriving a conclusion. Okay, so it's practically impossible to do a research on a single hand. Of course, there is a lot involved. Okay, and that also you just have to be very cautious about when you're doing a research. And there should be multiple levels of reviews required. So reviews in the sense, right, not only like after writing a manuscript and then sending it to review, that's a different part. So review in the sense, you just have to reinforce or like refine your research content or research question multiple times, even right from your topic. Research title has to be refined, and it has to be undergo a multiple review. Your aim and objective, your methodology, your drawing of sample size, how you are going to allocate the samples between the group, and then fixing a study design and adapting a right statistical methods for your study. Okay, and deriving a data, formulating a data, maybe coding a data, right, and even the discussion part what you're writing, and deriving to the conclusion. So each and every stage of the research has to undergo a multiple review through a group of panel of expertise or members, or maybe your colleagues or whoever. And there is a scientific review for novelty and then rational. So whenever people talk about the research, people too much talk about the novelty, like asking where is the novelty. Your study should be novel. On your personal note, you may not be, what you say, you cannot expect the novelty in each and every research. Okay, whereas you can expect the rational out of any particular research. Novelty is, it's something new. Okay, but every time you cannot be emphasizing on something new onto the research. But by doing a concrete, or like a fully scientific review, and then formulating a research question, somehow you can get into the rationale of your study, why you formulating a study particular way, and then why you need to do that, and that has to be justified to the greater extent. And other one, final one, is the ethical review of human subject protection. So as you want to do a study, okay, and you have to make sure the participants of your study is treated very well, their data should be confidential, right? How you're drawing your samples and how you're drawing your outcome measures, and then everything, each and every content or like data out of your participant, how you're what you say like segregating the data, okay? And especially when you're involving the human beings into the study, the ethical aspect has to be followed really well, okay? So these are the basic principles of your health research. Next will be the how much inquiry, inquiry into the things like what are the factors you have to consider before extracting the data from their particular research. First one will be the human host factors, okay? So human host factors in the sense, of course, most of your clinical studies are like our, even we will be handling the human beings. If your studies, most of the time is quantitative, where you will be like whether are you handling the healthy individual, or you are handling your population or sample is like people who are susceptible to any conditions or injuries, or even a diseased, okay? Sometimes, maybe not all the time. Whereas in physiotherapy perception, most of the time we end up in getting the data, or maybe like doing research on healthy people sometimes, okay? And also like people who are in the illnesses, where you will be extracting your data like your physical fitness level, maybe the posture, maybe the movement patterns, maybe their muscle power, and maybe their pain levels, okay? And these are the human host factors we will be extracting the data from the participants. And next one will be environmental and then social factors, and this also will be considered in any particular research. So when it comes to environmental and social factors, things like the workplace ergonomics and then occupational demands, and maybe their level of activity, and maybe the financial status, and these are the things has to be considered, or maybe like influencing their outcome. And other one is your healthcare infrastructure and then access, okay? So this plays the major role. So you might get the sample, you might get the deriving the population and then getting into the study, but always you have to check for the availability of your services and also the trained professionals when you are handling or doing your research. Trained professional in the sense, on the particular outcome what you're doing, the particular therapist or maybe a part of your researcher has to be trained in that particular deriving a data, or maybe doing a testing, and the accessibility to your study setting, that also plays a major role. And also like multifactor origin of diseases, like interaction of biomechanical, psychological, and then physiological factors, and these have the influence on your data outcome. So when it comes to the extraction of data, these many factors has to be considered when you are getting into the research. Okay. And here is the scope of a health research. So scope in the sense, by doing research, what you are trying to do, like maybe you will be generating a new information, or maybe you will be verifying the existing knowledge, and there will be a cause and effect of relationship of your study, or maybe evaluation of public health problems in a community level in a greater, bigger umbrella term, and maybe like you are testing the new interventions. So in case of generation of new information, let's give the example like innovation in exercise prescription or manual therapy and electrotherapy. For example, if you are trying to address any like ACL rehabilitation, or maybe a low back pain or post-operative conditions of any sake, so, okay, either you are generating a new hypothesis, in the sense you are generating a new information by means of your intervention again, okay? Either you formulating a new kind of manual therapy, or you are reinforcing a electrotherapy modality, or checking a upcoming new electrotherapy modality, or like making sure this excess prescription is right or not. So here it's like comes like more of like in the first slide which I was talking about, like theoretical research, where you're formulating a or generating a new information as such. This is one of the scope of your, can be a scope of your research. And next one is the verification of our existing knowledge. So existing knowledge in the sense, like you might be using a lot of approaches, a lot of modalities, a lot of frameworks will be using in your uh, intervention. Whereas your study can be like validation of established physiotherapy approaches using scientific methods, like identifying links between the movement patterns and then musculoskeletal disorders, for example. Okay. So we all know like movement patterns can affect your musculoskeletal health, or like musculoskeletal lesions. So again, your study, like, whether is it true or not, does the the faulty movement patterns affect the joint or not. So you are just like kind of validating the existing concept, just like a verification of your existing knowledge. And that also can be the scope of your health research. Next comes your cause and effect. When it comes to the cause and effect, like, whether this treatment is useful or not. What is the cause and then effect? What if I give the ultrasound to the lateral ligament of ankle injury, or maybe like any type of manual therapy techniques onto the particular condition, or maybe exercise regimen, okay? Whether there is a relationship between these X and Y, and that can be one of your scope of study. And next comes your evaluation of public health problems is a greater domain where the community physiotherapy itself, like, assessing the community-based physiotherapy and rehabilitation programs, like, where at the community level, okay, whether it's mass level of exercise awareness, or maybe like personal hygiene, or maybe like, exercise programs, healthy lifestyle, faulty ergonomics, maybe at the corporate level employees, those things also can be explored, where the this having the impact on the community level. And testing the new interventions is like, evaluate the new rehabilitation techniques and then exercise protocols. For example, if there is a emerging exercise protocols, any emerging new electrotherapy modalities, and that you just want to check whether the upcoming electrotherapy modalities or exercise programs or exercise techniques is useful to the community or to the patient, as useful as the well developed or gold standard treatment methods available. So these are the common scope of health research. Okay, this slide you can map it with your the first slide, where you have the, which I have talking about the theoretical framework or applied research or exploratory or confirmatory. Okay, and this goes there again. So your scope of research means what you're going to do by doing a research, and what made you to do the research can be, you can develop a new information or new theories, or you are just validating the existing knowledge or a existing treatment modality, for example, or simply you are just finding a relationship between a cause and effect on a particular condition or particular scenario, and or maybe at the community level, how it impact in reducing or preventing a disease or preventing a problem at the community level. And of course, the most common is the testing a new intervention, because a lot of approaches, a lot of theoretical frameworks, therapeutic frameworks have been coming up. So being a clinician, or being an academician, or even being a researcher, so people are wondering whether this is I mean, useful or not. Okay, that can be tested really well based on comparing the novel treatment methods with the existing gold standard treatment modalities, so that we'll come to know whether this thing or new modality is useful or not to the patient.